let's have a few seconds again spent with this question, try to see what is being asked, and let's move ahead accordingly. All right, so 68-year-old Richard with a persistent atrial fibrillation has been on heparin for the last 1 week. As a part of his continued anticoagulant therapy, he has been started on warfarin 5 mg PO QHs 2 days ago. And his PT-INR from the morning is reported as 17.2 and 1.3. Which of the following options, if taken by the nurse, is most appropriate? All right, and let's see the options we have. Option 1, continue heparin as ordered. Option 2, notify MD expecting an increase in warfarin dose. Option 3, notify MD expecting an increase in heparin dose. Option 4, continue warfarin as ordered. All right, so again, the question is about the patient with the atrial fibrillation, started on heparin, and then started on warfarin 2 days ago, right? And we have the PT-INR value. Okay. Now, how do we address this question? Now, again, based on my experience in the responses I got from people when this session was done in live, they may go with any options. Okay, yeah, depending on how we identify this information. Now, this is what we need to know. As I told you, in order to answer any such question, we should know the underlying content. If we do not know the appropriate content, there is nothing probably we can do about it. Now, let me bring you into the scenario that you may need to have in mind in order to identify what is being asked in the question. So imagine when a patient is coming with a sort of clotting, right, DVT or some sort of clot. What do? We put the patient immediately on heparin. Why? Because heparin has immediate anticoagulant effect, right? It's going to have immediate anticoagulant effect. That's going to reduce the risk of further clot. I mean, it does not dissolve the clot, but it can reduce the risk of further clot formation, right? So that's why we put the patient on heparin. Now, and while the patient is on heparin, what do we look for? We look for PTT, right? We look for PTT, to be specific, we call it the activated partial thromboplastin time. We keep monitoring every 6 hours. Based on that result, we may adjust or titrate the heparin dose. And then what do we expect? What's the expected PTT while patient is on warfarin? Sorry, while patient is on heparin is 25. Sorry, the normal is 25 to 35 seconds. The normal PTT is 25 to 35 seconds, and while patients are on heparin, we expect this number to go high by 1.5 to 2.5, or maybe 2 to 3, depending on the indication. This is what we may expect. So maybe instead of 25 to 35, so imagine the average is 30. Instead of 30, it may go probably around 60 to 75. So that's what we want, the effect of the patient being on heparin. Now, if it is less than the 60, the patient has risk of clotting. If it's above 75, there is risk of bleeding. I mean, this range is what we call as a therapeutic range. This is the expected purpose of the heparin treatment. Now, once this value becomes therapeutic, and usually a couple of days before discharge, patient will be switched into warfarin. Now, I'm going to erase this. Let me take you back. So patient will be switched into warfarin. Now, when patients are on warfarin, we look for PT-INR. Now, question, what's the normal PT? The normal PT is around 12 to 13 seconds, right? 12 to 13 seconds. And the INR, what is INR? So imagine, okay, that's a normal PT. So imagine for a patient, take it as an average, okay, just 12. And suppose today's PT is 24. That 24 divided by the normal PT 12, that's what becomes the INR. Okay, that becomes the INR, right? Okay. So yeah, that could be, again, could be in range of 1.5 to 2.5, or 2 to 3 based on the indication. Okay. So this is what we want. Now, when it's within this range, we call it as therapeutic. If it's less than that, patient at risk of clotting. If it's more than that, patient are at risk of bleeding. So this is the information we should keep in mind in order to answer this question. Now, yeah, that information what I just discussed with you is right here. You can see everything is put together right here, as you can see. Again, the heparin, yeah, the normal, in normal case, the PT is 25 to 35, while on heparin, you can see the range changes into 1.5 to 2 or 2 to 3, etc. And if it is less, risk of clotting. If it's high, risk of bleeding. And same with the warfarin, that's a normal, and INR is a patient's PT, while on warfarin by the normal PT, right? And yeah, it should be normal cases less than 1.3, but while on warfarin, we expect the number to go high, just like the heparin number. And if it's less than that, risk of clotting. If it's high, risk of bleeding. Now, for artificial heart valves, the target could be even higher. Hope you got a better picture on those values right here. Now, let me take you back to the question once more right here. So with the information we just learned, if you look here into this question, what can you actually see here? So you can see this patient, while this patient came in, we started the patient on heparin. That was a week ago. Now, as a part of continued anticoagulant therapy, the patient has been started on warfarin. It has been started on warfarin, 5 mg PO every night, 2 days ago, was started 2 days ago. And the PT-ANR is 17.2, 1.3. Now, based on what we discussed, now, first of all, while this question starts to talk about heparin, you can see later it is switching to warfarin. And this given value is, with warfarin, it's a PT-INR value, right? It's a PT-INR value. So the moment we talk, it is PT-ANR, then the heparin become insignificant in the case. The question is not about heparin, the question is about warfarin and the PT-INR value, as we need to understand. So based on what we discussed, this PT-INR value is subtherapeutic, right? It's not up to the expected or the targeted range. So what do we need to do? We need to keep, so we heard it should be, so if normal is 12 to 13, with the warfarin, it should go, 1.5 to 2.5 or 2 to 3 times. So probably around 20 to 30, it should come, but you can see it is kind of low. And so what do we need to do here? Should we just continue heparin? Is that the question? No, it is not. Okay, and or increase heparin? No, it's not. Now, first of all, I told you the question is not about heparin. When they start to talk about heparin, the switch into warfarin. Now we have option 2 and 4. Option 2, notify MD expecting an increase, versus option 4, continue warfarin. We already know this PT-ANR value is subtherapeutic. We need to increase the warfarin to prevent further risk of clotting. So you can see our answer becomes option B. Yes, that's right. The same information what we heard is what you can see here. The answer is option B, notify MD expecting an increase in the warfarin dose.